So if somebody goes to you and they're currently wearing a denture, what are their options when it comes to dental implants in your practice?
Well, the first option is putting 2 implants right here and having your lower dentures snap in so they don't just float around anymore, because every denture wearer, if they don't have implants, the number one complaint is the lower one. Okay. So that's the basic option, right? And then if you can afford it, or if you want, we can do 4 implants on the bottom, and then you can probably pretty much chew whatever you want. But the problem is it still comes in and out at night.
So a snap in, snap out.
It snaps in, snaps out, but it still comes in and out. But you can still chew a lot better than what you're chewing with just regular dentures. So on the lower, with just as little as 4 implants, I can give you a full set of teeth that never come in and out unless you come see me, right?
Okay.
Now with the upper, a lot of people, they complain that they can't taste their food. Or
the denture wearers.
The denture wearers, right? They can't taste their food, or they always have to use adhesive. Now our solution for them is we give them 4 to 6 implants, and we take that roof out, the whole palate out.
Okay.
And then from there, they're able to eat and taste food. At first, their wife, they complained that their wife couldn't cook very well.
Okay.
And it turns out that they just couldn't taste their wife's cooking.
Couldn't taste their food very well. Because I guess if you're drinking wine or whatever and your palate's covered,
you
no
can't
good.
no taste.
Because every denture, but the upper denture is snug though, right? Because of the suction.
Right. So if you don't if you have a normal denture and you don't have that palate, it just falls in and out.
Okay.
So the only way to keep it in, and if you don't want the palate, is by putting a couple implants in there. We could make it snap in with 4 implants, or we can also, with 4 implants, make it where it doesn't come in and out too.
So brand new teeth. And is this true too? On the day of the procedure, they can walk in with no teeth and walk out with upper and lower teeth that don't come out.
Yes, that's true.
Has that ever happened?
All the time.
Is that right?
Yeah. As long as their bone is good and if their bone, everything is stable that day, then they can.
So 80s, 90s, you can do this.
Yes,
upper
all
and
the
lower
time.
teeth that don't come out.
All the time. You can be 100 and still do it. There's people living to 105.
Why would a 100-year-old want to do this?
Because all they do nowadays is eat, right?
That's true.
That's so important to them. That's more important than driving. Because all they do at home is, breakfast, lunch, and dinner. And they value food so much at this point. And family gathering. So the 70, 80, 90, they really want the teeth that don't come in and out.
How soon could they eat?
That night. And as soon as you know it, they can eat their steak and their fried chicken like normal again.
So where you live in Texas, do they call you and say, Doc, are you sure I could start eating again? Are they scared at first, is what I'm saying?
Yeah, they're always scared about eating steak first, because that's what Texan people like. We like to eat barbecue, and we like to eat our fried chicken. So a lot of times my patient will call and say, hey, can I eat this fried chicken yet? And yeah.
So nothing is off limits?
Nothing.
If they wanted to, could they even chew the bones if they wanted to?
Yeah, yes. They can chew
the
bones.
So anything you can do, and they're permanent?
They're permanent. They don't come out. And if whatever you're using to break, we fix it at no charge.
Seems very painful though. But you say because of sedation, of course during the procedure they don't feel anything.
Right.
What about afterwards? If everything works out?
We just give them some ibuprofen and some Tylenol.
Could they also get medications if they need it?
Yeah, if they need something stronger, then we'll give them something stronger. But typically our normal patients just take some ibuprofen, some Tylenol, and they're very happy with that.